Who knew? If you're a sufferer of tinnitus, or if you've acquired some deafness, or you lost a little bit of your auditory capacity, just try to make that more grammatically correct, over the years, it might be something that you can fix with some simple exercises. I know, this might sound a little bit strange, okay? If you ever sleep with a little bit of a kink in your neck, wake up in the morning, your neck's a little bit sore. I've noticed this in particular, okay? Like, my hearing, not quite that good, okay? Like, I wear headphones quite a bit, especially when I'm out exercising, little in-ear gimmicks, okay? Little Bluetooth ones. If my neck is especially stiff, if I move it in the wrong direction, sometimes the old ear hole, it gets a little bit tighter and a little bit more constricted. That might be just a specifically me thing, but who knows if it's something that can be cured with exercise, because it seems to work whenever you loosen out the neck, do a couple of neck rolls. But we got 10 simple exercises. We'll see how simple this is, because we did something like this, I do believe, last week or the week before, when we took a look at different exercises to help strengthen the knee and alleviate some knee pain. So I like doing that stuff, so it kind of harkens back to my traditional roots on this type of stuff. So let's see if we can do it for the old headaroo, shall we? Tinnitus and hard of hearing are common oral clinical symptoms. A recent U.S. study found that nearly 1 in 10 Americans experienced tinnitus symptoms in 2021, but less than half sought medical attention. Yeah, it'll eventually go away. Don't worry about it. I'll just turn my music up. Wu Ku Pin. This was our fellow who was walking us through some of these exercises previously. Okay, said that the cause of tinnitus is fairly complex and results of multiple causes occurring at the same time. He pointed out the addition of acupuncture and TCM treatment, yes, mild, healthy exercise on the ears and massaging the surrounded areas can significantly improve related symptoms. Sweet. Even better results were seen in patients who received acupuncture more than 17 times. Yeah, but we ain't talking about that stuff right now. Okay, let's talk about the 5 tinnitus self-care exercises before we get into deafness with the last 5. That seems to make sense. Use a thumb and index finger to knead the ear 36 times from top to bottom, starting from the earlobe to the ear. What are we doing here, Doc? That sounds a little bit sketch, I'm just saying. Oh, okay, so just cycling around the ear from bottom all the way to the top and then just running back. Don't know why 36 times, but you do you. Number 2, open the middle finger and index finger in the form of a V. All right, something like, index finger and middle finger. All right, cool. Like you're fans of the Acclaimed. If you know that reference, congratulations, I guess. Place them in front of and behind the ear, respectively. Okay, and push from the bottom to the top, 36 times in one direction. You and your 36 times. Which way are we going about this, Doc? Let's see if we can figure this out. Oh, okay, cool. So right on the front, right by your earlobe, and then on the back, and then, oh, okay, cool. So just kind of massage your ear, as it were. Okay. Well, that kind of feels a little bit nice, I guess. And finally, I guess not finally. We're only on number 3. Put the palm of your hand straight on your ear and slap it as hard. No, straight on the ear and fold the ear flap back and forth 36 times. So yeah, just try to, make yourself do some Dumbo exercises. Okay, we don't need the illustration for that. That seems to make sense. Okay, so with the palms facing the ear canal, place your middle fingers horizontally on the back of your head with your index fingers and the middle finger. Flick the index fingers down the middle finger and tap the back of your head 36 times. A thumping sound like a drum. Ancient, heavenly, a drum. Ah, yes, very nice. So tap the back of your head to, I don't know, try to loosen some stuff up. It seems to make a little bit of sense. After pressing the ear inwards with the palm of your hands, all right, pull back out. Do that 36 times. Okay, so it's just basically short of taking your earlobe and just ripping it around. Outside of that, any way that you can figure out how to massage your ears, take care of that. So 5 more tinnitus enhancement therapy routines. Tell me more, Doc. For those with frequent cervical stiffness, if your neck is stiff, there you go, soreness and headaches, doing the previously introduced cervical spine self-rehabilitation methods before doing these tinnitus self-care exercises is recommended. All right, so yeah, I guess I'll link to that. But if there are knots and pains around the ears, massage and release them. So yeah, just take an assessment of everything that's going around on your old headeroo, see if there's any, knots that aren't like your skull. Like my skull right there seems to protrude a little bit. I don't think that that's anything, goofy. It's symmetrical on both sides, but outside of that, everything seems to be all in place. The temporal bone structure around the ear should be massaged and pressed to release, and the intercranial pressure around the ear. Where are you going with that one, Doc? That's which one I want to figure out, okay? So, yeah. Oh, I guess. Sure. So, that would be under that fissure right there. You should notice a little dent that's just directly above your ear, so I guess you just massage above that as well. Okay, cool. Kind of like when you're scratching around a dog's ear, the one that makes his back legs, just, go uncontrollably. Yeah, wherever you do that for a dog, right there for yourself, just give it a good little, massage as well. It looks like he's using his index and his thumb, so feel free. For those with nasal allergies, frequent nasal congestion, yes sir, and snot backflow. Gross, but yeah, okay. Bend the thumb and rub the side of it up and down both sides of the nose to promote circulation. Oh yeah, we talked about this one before. Different techniques to alleviate sinus pressure, like rubbing right there underneath your cheekbones. It's very nice, and I employ that quite a bit. Go back, and that one's about a month ago. I like that. I incorporate that technique quite a bit. Yeah, they talk about ki and all that stuff. Yeah, send the doc your energy. Sleep disorders can easily aggravate the symptoms of tinnitus. Dr. Wu recommends doing more exercises for the cervical spine rehabilitation method. Yes, like correcting your posture, okay, looking straight forward, massaging both sides of your neck at the time, okay, lengthening it out. One good thing that I picked up from my time in college, okay, going to get my exercise physiology degree. Pretend like when you're standing straight up with perfect posture, with your head tilted slightly down. Imagine on the crown of your head, okay, right at the top, there's a hook, okay? Go with me for a second. Imagine that there's a hook on the top there, and that there's a string pulling you straight up, aligning your spine all the way from your heels, through your ankles, through your knees, through your hips, through your spine, the entire gimmick, all the way to the top, okay? Stand as tall as you possibly can without getting up on your tippy toes. Do that, look straight forward, tilt your chin down just a little bit so that the top, that hook that is sitting right at the top of your crown is pointed directly up, and that the rope that's attached to it is just slightly pulling a little bit, not for other activities involving a rope in your head, but, just pulling you straight up like that. It puts everything in position, your ears with your shoulder with your hips with your knees with your ankles. Everything is all fine and wonderful. And then once you acquire that posture on both sides, not over the spine, because massaging your spine is painful and can cause some problems as well. But if you notice any imbalances in the muscles at the back of your neck, okay, massage them out, okay? Always try to work, okay? Push the muscle so that the blood flow is going back towards the heart, because that's the natural way that your body wants to try to push the blood anyway. So always try to massage downward to return the blood, to return any of the plasma back towards the heart, okay? So that even works, okay, if you're massaging your legs, massaging upwards towards, okay? Work with the flow of your body. Work with the flow of blood. Do that, 36 times? Okay, is that the catchy number that we're going with, thanks to traditional Chinese medicine? I would just say, for however long that you want, okay? Not so much that, your fingers are bleeding or you're, in any form of discomfort, but I've tried a couple of different, neck gimmicks that purport to stretch out the neck a little bit, but nothing's been quite as effective as just maintaining good posture, massaging the neck, the traps as well, getting everything nice and loose in there, doing a couple of head rolls, okay, looking down, just trying to touch ear to shoulder on both sides. You don't need to look backwards because that puts undue pressure on your neck and then also compresses your neck in a way that it's not necessarily designed to be going. So yeah, if that helps with deafness, tinnitus, anything that's caused by an inflammation of your neck muscles that's constricting your oral, your auditory canals that are in there as well, you can hopefully alleviate that with exercise, with stretching, and then also, just a less inflammatory diet. But with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.